OCD stands for Obsessive-compulsive disorder, and really it's just one form of anxiety disorder. So all of us get anxious sometimes, we get scared about things, but if you have OCD, you feel that there are things you have to do to keep a bad thing from happening. And the thing is, these things aren't things that would actually keep a bad thing from happening. So you want to pass a test, you're going to study for the test. That's normal, that's a healthy form of anxiety. But in OCD, you feel that if you don't, for example, tap a door frame when you walk through it, maybe somebody in your family is going to die. Or if you don't wash your hands exactly 20 times before a meal, maybe you'll get sick from a germ. So OCD gives us this sort of sense that doing something that a lot of people would think is irrational will keep something horrible from happening. And the tough thing with OCD is even though you know in your brain somewhere that this doesn't really make sense, tapping a door or washing my hands or turning around a certain number of times or wearing a certain color isn't really going to prevent a bad thing from happening, it's almost impossible not to do it. So when people get this really severely, they can have a tough time getting out of the house because they have a ritual and they feel like maybe I didn't do it right, so I have to go back and do it again. Or they can get skin breakdown on their hands from washing them so often, or get fungal infections from standing in the shower for hours trying to get exactly the right amount of clean. So if you feel like you're starting to have these feelings, these impulses, you want to talk to somebody about them, because anxiety disorders, including OCD, are really great things to treat. We have a lot of treatments that work. Some of those treatments are medications, but in many cases, other treatments like cognitive behavioral therapy, which is really just talking to a therapist about how we deal with some of these feelings. Meditation, relaxation. There are a lot of fantastic therapeutic interventions that we have to help with anxiety disorders, including obsessive-compulsive disorder. So if you're starting to have these feelings, for gosh sake, talk to your doctor, talk to a therapist, because there's so much we can do.